Good afternoon. This is day 91 of the Ukrainian resistance, and the Mediacenter Ukraine is in the works. Our today's day, we will start with the briefing of Mr. Orest Chemerys, Director of the Healthcare Department of Lviv Oblast Military Administration. Orest, the floor is yours. Good afternoon. Glory to Ukraine. Glory to the heroes. Orest, our first question is as follows. Can you expand on the current state of play in the healthcare sector in the region after 3 months of the war? As of today, the healthcare sector itself is in satisfactory condition. We are coping with all the challenges created by the Russian Federation of Ukraine. We are also coping with the current burden created on our healthcare sector, because we have had different numbers of IDPs that required medical aid. So right now, we can state with certainty that we have successfully overcome all the current challenges and setbacks. To what extent has the load on the system increased in percentage or in quantities? What kind of medical aid is available and accessible to IDPs? How many of them require medical aid? What about the staffing issues? Nurses, doctors, maybe some of them left the countries, but others moved here from other regions of Ukraine. Can you elucidate all these issues? Since the outbreak of the Russian war, according to various data, we have about 200,000 to 500,000 IDPs. With this increase in the population, the load on the healthcare system has mounted as well. In terms of percentage, we are talking about a 15 to 20% increase. If we analyze the number of requests received by healthcare institutions, they amounted to upwards of 80,000 requests for different types of medical aid, inpatient and outpatient, and dozens of thousands of IDPs have already undergone treatment in our healthcare institutions. In terms of the quality of treatment and healthcare, since the outbreak of the war, we have not had any major issues with staffing. Most of the doctors stayed in Lviv and Lviv region. Some of the medics joined the ranks of the armed forces of Ukraine, so they are working in military hospitals, in the front line, on the battlefield. We don't really have a shortage of nurses and other medics. We are capable of securing high-quality healthcare. Our cancer center has been under enormous strain as well, because we have to continue offering radiation and chemotherapy, but despite the increasing number of requests, we continue providing high-quality healthcare services to all those people that are living in Lviv region, including IDPs, including those people that required some medications and drugs, and most of these medications are procured from the state budget. All this is also possible due to responsiveness of the Ministry of Health of Ukraine. We were able to redistribute drugs in such a manner that we did not have any shortages and we did not really have medical supplies issues. What about the treatment of the Ukrainian wounded military in Lviv region? It's ongoing and with high quality. What about the coronavirus? The guidelines from the ministry have changed. Some of the rules have been amended as well. Can you elucidate these changes? What is the current state of play with the vaccination in Lviv region? So what is the current situation with the coronavirus to start with? Well, in fact, the coronavirus is still there. It hasn't disappeared, but it just happened so that since the onset of the Russian aggression, we observed a decrease in the in the case count, and we still have a low level of case count. Most of the coronavirus patients have mild symptoms. We have 67 inpatients. This is a low number in comparison with some peak periods. Back then, we had about 3,500. In terms of restrictions, some of them have already been lifted, and most of them are of advisory nature, like mask wearing, availability of a vaccination certificate. But I would like to reiterate that we should not neglect COVID-19 when we are in crowded places, when we are in tight spaces. We still recommend that people wear masks, and we recommend that people continue getting vaccinated. We have this positive situation with the coronavirus right now because a large percentage of Ukrainians were vaccinated before the Russian aggression. So let's get vaccinated and let's not brush aside COVID-19. And the most urgent and relevant question, monkeypox, what is it? Should Ukraine brace for it? And is there a threat from Ukraine? Well, as for the monkeypox, there have been a lot of ambivalent messages, several hundred cases registered, and it's alarming that these cases were registered in some countries where it's not typical, like the US, Israel, and EU member states. It's an infectious disease that is more typical of African countries. The possibility of getting infected is there, and usually you contract this virus via direct contact or exposure to the infected person. Is there a threat to Ukraine? We cannot really exclude this possibility, but as per the latest data of the Ministry of Health of Ukraine, we don't have any documented cases in Ukraine. But if there's fever or a very specific rash, this is a rash that is typical of this virus. So if you notice any of these symptoms, please approach the relevant healthcare institutions. We have disseminated a wide variety of information materials. The algorithm is well known, and we know exactly what needs to be done if people identify any of these symptoms. So do not delay this decision. If you identify any of the symptoms, please approach your doctors. Any questions from the audience? Can we have the mic, please? Thank you very much. I have the following question. Considering the large number of people in the city, considering continuous domestic migration processes, is there a threat from infectious diseases or some sort of outbreaks like hepatitis, poliomyelitis, and some other ones? What should we be cautious about? You mentioned exactly right that any increase in the number of population is a risk factor, and we should be primarily concerned about collective homes, because we have had sporadic outbursts of infectious diseases, especially in collective homes for IDPs. All the patients have received required medical treatment. Their condition is stable. So the risks are there because we are experiencing enormous migration processes. It's important for family doctors to understand how many declarations they have, what the potential risks and threats are. And this mass migration definitely can provoke the outburst of all sorts of diseases and viruses. But once again, let me repeat that it's been 3 months since the outbreak of the war, and we have not really observed any massive outbursts. So the massive outbursts have not been there, but what should we be concerned about? Maybe hepatitis, well, TB is possible, hepatitis is possible as well. First and foremost, we focus on those facilities that are sheltering large numbers of IDPs. Our epidemiologists are actively engaged. We need to focus on prevention. We also had some site visits of our doctors to collective homes for IDPs. We have staged an active promotional campaign on the need for scheduled vaccinations. These vaccinations have been conducted. So TB, hepatitis, definitely these are the primary conditions that we can have outbursts of. Can you articulate any numbers? Have we had any cases of such diseases among IDPs? Some acute intestinal infections, 5 to 17 persons. But the condition of these patients was moderate, and as of now, all these patients have been treated and they have been discharged from hospitals in a satisfactory condition. Another question? I have the following question. What about your cooperation with the foreign medical sectors? And what are your current needs? Thank you for this question. We do have a close cooperation, and this is the cooperation initiated and promoted by the Ministry of Health of Ukraine. Owing to the initiatives by the Ministry of Health of Ukraine, we have a single network of clinics where we can refer our citizens, those citizens that have suffered as a result of the Russian aggression. There's a large number of countries that offered a helping hand. As of today, in terms of numbers, upwards of 800 people have already been referred abroad for treatment in clinic in Austria, in Germany, in some other EU member states, and the Ministry of Health is in coordination of this process. Please introduce yourself. Оля Шведа, Media Hub Твоє місто. I have another question, if I may. You shared that the coronavirus is still here. Can you provide us with some stats, especially on the vaccination rate, in particular the vaccination rate among IDPs? The vaccination is ongoing, considering that we are working under martial law. This is the right decision. This is the pertinent requirement. We shut down some of the vaccination centers that we had in different facilities, and now you can get vaccinated in primary healthcare institutions, in outpatient facilities, in special vaccination rooms. As of today, in terms of the numbers of vaccinated citizens, about 1 million citizens have already received 2 shots. Despite the war, the vaccination is still quite active and intensive. Recently, the numbers have decreased, but let me reiterate that the vaccination process is still ongoing. Several hundred people come to us on a daily basis. All right, the last question. Thank you. I have one follow-up question, or one point of clarification about monkeypox. So, is it possible for this virus to spread in Ukraine? And do they know how to identify this virus on the border, let's say? Once again, together with the Ministry of Health of Ukraine, we are staging a robust media campaign. Is the risk there? Well, definitely. There's always a risk for any infectious disease or virus. It depends on whether we will have any infected persons enter the territory of Ukraine, and whether these infected people have exposure to Ukrainians. There's a number of symptoms that we need to take into account: fever, typical rashes that can be red flags, and once we identify such clinical symptoms, we will definitely refer these patients for further examination. Thank you very much. We had Orest Chemerys, Director of the Healthcare Department of Lviv Oblast Military Administration, with us. Our next briefing will take place in about 15 minutes, and we will be talking with Natalia Homenyuk, Chief of the Joint Coordination Press Office of the South of Ukraine Security and Defense Forces. She will join us on